Hi, I want to talk for a few minutes today about your progress and where you may go from here, also about your health. If you think about health for a minute, what does it really mean to you? How would you define health? Most people would maybe say, well, if I get up in the morning, I'm healthy, or if I don't have pain, I'm healthy. But in fact, if you look up the definition of health, most dictionaries are going to say something along the lines of health being a condition of wholeness where 100% of your body is functioning 100% of the time. If you look up a definition from the Tabor's Medical Dictionary, it says it's a condition in which all functions of the body and mind are normally active. It doesn't say anything about symptoms or lack of symptoms. So one of the most dangerous things you can do is judge your health based on your symptoms or not having symptoms. I'll give you a couple examples of that. Do you know what the number one and number two disease killers in the United States are? Yeah, heart disease is number one and cancer is number two. With heart disease, the first symptom that most people have is typically the heart attack. It's not actually the pain down the arm, it's the heart attack itself. So some people do get that pain, but most people never feel anything until the actual event. With cancer, by the time it becomes painful, the problem has usually been there for several months. Some other examples you could think of where you don't want to judge your health based on symptoms. How about food poisoning? Let's say you go out to eat tonight and unfortunately you get food poisoning. Your body's going to want to get rid of that poison. You're going to have a lot of symptoms. You're not going to like those symptoms. They're not going to be pleasant, but your body's doing exactly what it needs to do. God designed us with an innate intelligence that knows what needs to happen. And our brain and our spinal cord are constantly communicating with our body and coordinating what's going on, allowing us to keep what's called homeostasis. That's just a good balance in the body that helps to keep you alive. One more example I just want to give you of that is fever. Most people think fever is a bad thing. Not necessarily, not always. A lot of times fever can actually help your body's immune response be stronger and better to fight off things like viruses, bacteria, stuff like that that might enter the body. So don't think of your health just based on your symptoms. Think of it being your body actually functioning at 100%. When we look at the spine, we've got nerves going out to all the different cells, tissues, and organs. There are some really important ones that are called your autonomic nerves. These are ones that you don't even have to think about. Your brain is constantly monitoring things like your blood pressure, your breathing, liver functions, digestive. Those are just a few of thousands. But it's monitoring those, and then it's sending signals up and down your spine to communicate with your body and tell your body if it needs to maybe speed up your heart or slow it down, or let's say, speed up your breathing. So think about if you were to jump up and run outside and try to run across Oak Ridge Highway and dodge traffic, you're going to have to start, pumping more blood to your muscles. You want your heart to start beating faster. That's your fight or flight response. That can be a good thing sometimes when you need it, but you don't want that to be active all the time. Unfortunately, that happens in a lot of people. Those nerves going out to those organs that are the accelerator nerves, they are firing all the time. And instead of resting, those organs can get fatigued. They can wear out quickly. I like to think of the spine a little bit like a highway. If you think of your spinal cord being like I-40, when all the lanes are open and traffic's moving smoothly, that's good. That means the brain is able to communicate back and forth, and traffic is moving in both directions, reception and commands coming from your brain. But sometimes there are traffic jams. There might be a wreck on I-40 or construction, something like that, that's blocking that flow of traffic, and then it just doesn't get through as well as it should, right? Same thing is true with those signals coming to and from your brain. So we always want to make sure that those are functioning as well as possible, and the chiropractic adjustment is one of the best ways to do that. If we take a cross section of your spinal cord, these are those autonomics I was talking about. They comprise about 45% of your spinal cord. Another 45% are your motor nerves. If those get pinched, you can have muscle weakness, muscle spasms, fatigue, tightness, even paralysis if it gets pinched completely. Sensory nerves, those are going to be the ones that detect pain, but just a few of them. The rest of them are going to detect things like posture, touch, temperature, things like that. So feeling good doesn't necessarily equal good health. Good health equals proper function of all of these. You may have seen some infants in our office getting adjusted, or maybe you bring your baby in yourself to get adjusted. And sometimes people are like, well, why would a baby need to be adjusted? But if you think about it, the birth process is a big physical trauma in that baby's life. Somebody probably grabbed that baby by the head and they started pulling and twisting. And, we're talking a little baby. It's like, 5 to 9 pounds on average. So not a lot of strength in their neck, but we're putting a lot of force on there. Even in a C-section delivery, they usually grab by an arm or leg and they start pulling, and kind of the baby's head flops side to side. So a lot can happen to that baby's cervical spine, especially during birth. An adjustment for an infant is very, very gentle. Typically, we just need to wiggle that top bone, that atlas vertebrae, back into place. And it only takes the pressure that it would take to dent a ripe tomato that we're pushing on that baby. So it's not nearly as forceful as the type of an adjustment that you might see with yourself or with other adults. When people get to this point in their care, or sometimes even when they first start care, they might ask me, well, I've been coming in frequently, or could I just come in every day of the week and do that for a few months and then I'd be all set and never really need to get adjusted again because everything is going to hold in place? That would be nice if that could do that, but that would be kind of like going home and brushing your teeth for 3 straight hours tonight. You'd have really clean teeth before you go to bed, but what are you going to have to do again tomorrow if you want clean teeth? And the day after that, and the day after that? Probably going to have to brush them again, right? There's no amount of brushing that you can do today that's going to guarantee you clean teeth a week from now or a month from now. So unfortunately with the spine, we've got gravity pulling down on us all the time. We've got all those chemical, emotional, and physical stresses that build up throughout our lives at work and different things that we do that are constantly pulling things out of place. So we have to maintain that just like you would with your oral hygiene. I like to think of it a little bit like climbing up a mountain. When you first started chiropractic care, it was probably a bit of an uphill climb. Most people maybe feel a little bit worse before they start to get better, but you get over that pretty quickly typically. And then you start to progress, start climbing up the mountain, getting better and better. Now, what do you think most people say happens to their health after they pass the age of 30? You think it gets better or it gets worse? Yeah, most people in the United States say that their health gets worse after the age of 30. Our practice members are the opposite. We've actually had people come in their 80s and 90s that their care has gotten, or their health has gotten better. And that's measurable through blood tests, through thyroid function tests, liver function. So we can actually see that on paper and through testing. I'm not recommending that you wait till you're 80 or 90 to start chiropractic care. It's certainly easy to correct things earlier than it is to wait until that point. But I do want to warn you, sometimes when you climb up there and you're getting healthier and healthier, you get up to this pain-free plateau, and then you don't have those alarms, those smoke alarms blaring in your back anymore saying, take care of your spine, take care of your spine. And so people will tend to quit care at that point. That's when they spiral back downhill, and then we typically see them back in the office a few months later, and they're back where they started. Unfortunately, once they've done that, it's a lot harder to get them back up to where they were when they stopped care for some reason. So it makes a lot more sense to get up to that pain-free plateau and then continue care to this maximum health potential, the top of the mountain where everything is just nice and level. It's a lot easier maintaining that healthy spine once you get up there than it is correcting the diseased, rotten, worn out spine. So it does take time. It takes repetition to get up to this. Some studies show about 1 to 3 years for correction to get everything up to the recovery stage. That's why we like to get children and infants into the office as soon as possible. They are already starting pretty high on this mountain and don't have very far to get to that recovery stage compared to somebody that's had a problem for 20, 30 years. So what does this all mean to you? What does health mean to you? Hopefully you're maybe thinking about it a little bit differently now than when we started this video. To me, it means being able to do things with my friends, my family, my loved ones, and being able to do them on my own terms, not what my health dictates. If I want to go for a long hike, then I want to be able to do that. Most people don't want to be in and out of hospitals or wind up in a nursing home. So this is something just to kind of think about and keep in mind for the future. We're not always as concerned with what your spine is looking like today or how you're feeling today. We're adjusting you for your overall health and how your spine is going to look in 20, 40 years from now. So I really do appreciate you, and I'm looking forward to seeing how your health continues to progress from this point forward.